Welcome to Healthcare on the Rocks, Employee Benefits with a Twist. I'm Brittany Hardaway, Director of Strategic Partnerships at Springbuk.
And I'm David Pittman, Vice President of Marketing at Springbuk. Today, we're diving into the world of telehealth and virtual care with an industry expert who's reshaping how healthcare is delivered.
Our guest today is Lauren Gumbs, Executive Vice President of Clinic Services at Transcarent. Lauren brings over 20 years of healthcare leadership experience, overseeing a 24/7 nationwide virtual primary care and behavioral health clinic serving 4 million members. Her background includes scaling ambulatory care at the University of Washington Medicine and leadership roles at 98.6. Lauren, welcome to the show.
Thank you so much for having me. I'm super excited to be here today.
And we're really excited that you could join us. And I understand this is your first podcast.
This is my inaugural podcast, so bear with me.
I'm sure you'll be great. Before we get into the main topic, though, tell us a little bit about you. What are some of your interests outside of work?
Yeah, thank you. Love to travel. We try to travel internationally as much as we can when we get a break from work. We have 2 kids, teenagers, one in college and one in high school, and so love to explore. We're all foodies in this house and get outside as much as possible.
Great, love to hear that. So before we go further, I've got to know favorite place you've gone so far and place you're most looking forward to.
Favorite place I've gone is New Zealand. It is jaw-droppingly gorgeous. And on our bucket list is South Africa. Just talking about it last night.
Wow, both great ones. Excellent. I've never been to either, so I'm assuming they're both great. But yeah, I would like to go to both of those myself. Okay, Lauren, let's dig into it. Most Americans, as we all know, have a smartphone, and they're increasingly thinking of how we interact with those devices and all the apps, the easy-to-use apps that we have on them. And people are starting to wonder how their healthcare experience could be improved. So how do you see telehealth and virtual care fitting in with these evolving consumer expectations?
Yeah, it's a great question. As we all know, and as you just said, David, consumers are accessing all types of resources differently due to technology. We know that there are a billion healthcare searches every day on Google. So people clearly want answers now. The convenience to accessible information is important, and healthcare is no different. I think the difference between getting information on Google versus a platform like Transcarent or any other telehealth platform is that with a telehealth platform, you're getting urgency and accuracy. Sometimes when you put in a search information into Google, what you might get back, you're unsure if it's a reliable source or not. So with the telehealth platform, you're getting best-in-class, evidence-based best practices. So I like to say that's urgency and accuracy. Members are increasingly becoming tech-savvy, and so they're expecting this convenience, accessibility, and healthcare is no different. If they have 15 minutes while they're on a break, they want to be able to access healthcare. If they're in line picking up their child and you're in that long line of cars and you have 5-10 minutes, you want to be able to access healthcare on your phone on your own time, not on the provider's time, not based on when there might be clinic availability. And so having that access and convenience on your phone is what consumers are expecting. And one statistic that I like to share is that we think that maybe all Americans in the US do not have access to phones, and that's actually incorrect. In 2023, I saw a statistic that said 90% of the US population actually has smartphones. And of those smartphone users, 96% prefer text. So that is how we are communicating. And again, healthcare should be no different. In my preamble, I said I have a college student and a high school student. My college age student, she accesses her healthcare through her primary care provider via telehealth. Like that is her mode of connection with her provider. I had COVID, unfortunately, 2 weeks ago. And from the minute I came in for a visit to when I actually had Paxlovid in my hand, thanks to my husband for going out and getting it, was 42 minutes. Like I literally was counting. And so it's really just amazing sort of where we've come and how technology has augmented our visibility and access into healthcare. So this is really the kind of healthcare experiences that consumers are demanding, all while driving down the cost. US healthcare costs are expected to grow on average 5.5% year over year. And by 2031, the healthcare spend in the US is going to be $7.2 trillion. That is extraordinary. So from a care delivery perspective, which I oversee and I provide leadership, I feel like it's my responsibility to assist in controlling costs.
Telehealth use skyrocketed during the pandemic as the industry sought to maintain access when in-person care was limited. While the volume has decreased, it's still significantly higher than pre-pandemic levels. And you mentioned, Lauren, in your experience with COVID just a few weeks ago, my primary care physician, she won't even see anybody who's actually sick in the office. That's a mandatory virtual visit. So where do you see the industry going? What does the sustainable model of virtual care look like in the future?
Yeah, indeed, the pandemic has accelerated the adoption of telehealth. There's no doubt in that. The surge has tapered off, but telehealth usage remains significantly higher than pre-pandemic levels. I think I read the other day that it's stabilized at about 38% higher than pre-pandemic. So although it's tapered off, it's still what we believe and how people want to access telehealth and virtual care. A sustainable model of virtual care will likely be driven by the integration of AI. I'm sure we'll get to AI somewhere in this conversation, but data-driven solutions and creating a more personalized medicine and care delivery is what is going to be expected from the consumer. AI is going to help drive down costs, reduce administrative burdens, and ultimately improve patient outcomes. That's ultimately the end game here, is that people get healthier, they stay healthy. Our CEO often quotes Winston Churchill when talking about the future of telehealth and virtual care by saying, "Now is not the end, it's not even the beginning of the end, but it is perhaps the end of the beginning." And that just rings so true. If we think about other industries such as banking, digital banking, or virtual travel, those things are just common nature, and that is where healthcare is. Digital health is just going to be, it's going to be the common practice. I mean, when was the last time you walked in a bank? It's been years for me, for sure. And so that is how we bank today. I believe that we're just scratching the surface on how technology is going to transform the delivery of health and care.
And who knew Churchill was using virtual health?
Way before his time.
Well, one aspect of virtual care, and you mentioned it, Lauren, with your daughter, is text-based communication. Can providers really, truly build a relationship with their patients via text? And can virtual care through texting solve some of those persistent issues of utilization and member engagement?
Yeah, thank you. I believe providers indeed can build a very meaningful relationship with their patients. And there's a couple reasons. One is because of the immediacy and convenience to texting with your provider. So you're reaching out to your provider when you need care, not in 3 weeks or 6 months when they're available. So there's an urgency that creates an immediate engagement, and that builds connection and trust. It also provides a level of privacy. So actually, I believe patients are getting increased accuracy in their diagnosis because they're more forthcoming in what's going on with them. I think we all know and have experienced the white coat effect, which is you get into a provider's office and all of a sudden your blood pressure rises and you forget about all the symptoms and all the things you wanted to talk about with your provider. But if you're at home or on the bus or we're not going to be texting and driving, but if we're pulled over and we're waiting for childcare pickup, you want care now. That availability to connect with your provider at the highest need is what creates engagement and utilization. Another aspect, I think, of text-based care that's important to call out is that website manner. A provider needs to connect with the patient They need to feel the authenticity and the vulnerability of the patient. And so it's their responsibility to pull the patient into the visit. And you can absolutely do that via text, via that communication mode. One question you didn't ask, but I'm going to offer is one of the things that we're seeing in this world of telehealth and virtual care is the camaraderie amongst the medical group and amongst the providers themselves. It is tremendous what kind of collaboration comes out of a virtual health practice. I've seen physicians and nurse practitioners who have practiced with colleagues for 15 or 20 years, and they say that they know their colleagues in the telehealth business better than they did their practitioners and their colleagues in brick and mortar. And that's because when you're in a brick and mortar setting, you go in, especially in primary care, you're seeing 25 minimum patients a day, and then you're probably doing about 3 to 4 hours of documentation. You don't have time to chat and do the water cooler conversation with your colleagues. And in telehealth and in virtual care, you do. And in fact, you're often reaching out to your colleagues to ask questions. What do you think about this rash? What do you think about this diagnosis? And so it's a very collaborative environment, almost more so than a brick and mortar setting.
I can definitely see that. Employers face a lot of pressure to build benefit programs that enable their employees to be healthy and productive. What are some of the reasons employers are investing in on-demand virtual care programs?
Yeah, I think it's very important that employers understand this. A healthy workforce really drives down costs and increases productivity. So keeping your employees healthy and satisfied and giving them the right care at the right time is actually incredibly critical for the employer to drive down costs and increase employee satisfaction, especially in primary care and mental health. As we know, mental health and personal well-being, unfortunately, the need has exploded globally, but certainly nationally. And so when a employee needs care, again, they need care now, not in 6 months when they can get in to see a provider. So it's important to give your employees access to high quality care that is immediate, that is convenient to the employee themselves. It's important for an employee to think about that it's a flexible, comprehensive benefit that will boost productivity. And ultimately, if you have a happy workforce, you're going to retain top talent. And we know it's in competitive environment and competitive market right now. So it's critical that employers are retaining the top talent.
All right, Lauren, you know that our primary clients are the employers and the advisors who help them. When this episode airs, we will be just past open enrollment time. Employers are already going to be looking forward to the programs that they're offering next year in 2025. So if an employer is evaluating their current virtual care program or thinking about implementing one, what might be some of the factors that you would recommend they consider when assessing the success of their program?
Yeah, that's a great question. It's really important that employers are looking at employee engagement. We just talked about that in the last question you asked, but are employees engaged? Are they accessing the benefits that an employer is offering? So if they're not accessing it and they're not engaged, then you're not going to gain the benefit that you're offering your employees. So really knowing your workforce and making sure that they're engaged and they're actually utilizing the services that you're offering. I think it's important for an employee to look at health outcomes. You can't just look at are they accessing it, the services and the point solutions or the integrated care and how engaged are they, but what is the quality that's being delivered? And are your members, your patients, or your employees getting better? Are they staying healthy? Are the point solutions that you're offering and the platforms that you're offering, are they making a difference? And ultimately, if you're making a difference and your employee population is staying healthy, it's going to drive down your own healthcare cost. We also need to look at employee satisfaction. I already talked about employee engagement, but what is the ease of use of the platform? How well does it integrate with the other benefits? Is it seamless across the platform to the employee? And are there comprehensive care offerings? Are they integrated with other solutions? So all these factors will help determine the efficacy of a program and in support of health, engagement, and productivity, which is ultimately what an employer is looking for.
That's very interesting. So, I mean, we've seen some pretty high profile exits from the telehealth space in the last 6 months. So, just to piggyback on what you've already mentioned, as employers evaluate these solutions, what else should they keep in mind?
Yes, I agree. We've seen some high profile exits in the telehealth space, indeed. I think it's important that employers look at a platform or a product that is able to scale and will have an impact on the employee's health and wellness. There are a couple factors that one should consider. Again, enhanced utilization. Are partners reporting higher utilization rates in comparison to their previous telehealth providers? We see a lot of telehealth providers out there with very low utilization. Why is that? Why are the members not accessing care? Perhaps it's not convenient, perhaps it's not easy to use. So you need to look at the enhanced utilization. One aspect we haven't talked about today that I think is incredibly important is language inclusivity. Are the platforms supporting translation of language and making it accessible to their diverse member base? That is extremely important. We see so many employers that have and support members that speak multiple languages, and we want to make sure that we're offering a service that is in the natural language of that member. Another aspect one should consider is the rapid deployment. So once you sign a contract or an employer signs a contract and they receive the eligibility file of all its members, how long does it take for the platform to go live? What type of disruption? Hopefully minimal disruption and maximum efficiency. And then what is the proven track record of the platform or the product? I would look into getting references from current clients, big businesses, health plans, large self-insured employers, so understanding the current retention rate and the client success.
Lauren, earlier you said a phrase that got my ears tingling a little bit. AI. I'm a huge proponent of AI, and it seems these days, every conversation in the tech space includes at least some passing reference to AI. So how does it factor into the delivery of telehealth, and what do employers need to know about it?
Thanks, David. I too love this question. I love talking about AI. What we're doing at Transcarent, I think, is groundbreaking, and I think it's extremely exciting time for all of us. I don't know about in your career, but I feel like this is the most innovative space we've been in since I've been a working professional, more so than the .com business. So thank you for the question. I do believe that AI is playing a very key role in enhancing personalization, improving the diagnostic accuracy, and streamlining care delivery. We are implementing AI at Transcarent to not only deliver member satisfaction, but also for our providers. It is decreasing clinician burnout. We have to take care of those that are taking care of us. And so what we're doing with AI is delivering to the providers exactly what they need to know at the right time to deliver high quality care to the members. And AI can absolutely do that for not only our providers, but for our member experience. For employers, it's important to understand how AI can drive better outcomes, increase efficiency, and reduce cost in telehealth. It's crucial for evaluating the effectiveness of programs and ensuring that they meet their employees' needs. I love to talk about this example where a patient came in from Washington State. The provider was licensed and actually practicing medicine in Washington State, and they came in with an unusual rash. The provider asked to take a picture of the rash of the patient, and within seconds, the AI digitally scans the picture that the patient sent in. And again, within seconds, the AI scans and delivers probable diagnosis. So let's say in this case, it's a tick bite. So you don't see ticks in Washington State very often. The practicing provider who is in Washington State may not know what a tick bite or a rash looks like. In a brick and mortar setting, this patient may have gone into a primary care provider and either been referred to an infectious disease doctor, referred to a dermatologist, or almost worse, been misdiagnosed. And we know with tick bites, it is extremely important to get appropriate care quickly. Otherwise, you have these chronic longitudinal symptoms that are quite debilitating. So in this case, the AI was assisting the provider of, I've seen this, I know what this is probable tick. And then it basically serves the provider information at the right time for the patient to get the best care. So I do think that employers should be looking at how platforms and telehealth and virtual care can help support the effectiveness of quality care as well as decrease cost.
That's a great example. Thanks.
It is. That is truly amazing. So, all of this talk about technology and AI, security and privacy are definitely top concerns in healthcare. What measures might employers want to ensure are in place when they're considering virtual care solutions to protect their members' data?
Yeah, this is so important. Employees trust their employers with health information. And we know that cybersecurity threats continue and are on the rise. And so it's important to ensure that virtual care partners are employing best-in-class security programs. There are a number of factors that one should be considering. We all know HIPAA compliance, that's the bread and butter. It protects our personal health information. This might seem like a no-brainer, but the stakes are too high not to overlook. You have to look at the various compliance programs an employer or a platform has. Another area to look at would be security certification. Does the platform offer SOC 2? Are they high trust? These, again, this should be just basic table stakes, but you'd be surprised at how many platforms out there are not security protected or don't have the certifications. Another aspect that's a little bit more new in the industry is creating an AI governance program. And the governance program really needs to be compliant with the National Institute of Standards and Technology. Again, I'm not sure we've seen too many telehealth or virtual platforms that have an AI governance structure, or they're just putting one in place. And this is critical to ensure that the policies that are being developed in-house do adhere to the federal and state laws. And there are a lot around and a lot changing around the regulations related to the development, deployment, and the usage of AI systems. So it is very important that when you're looking at a platform and the employers are looking at solutions, that they're going through all the factors to make sure that their employees' health information is protected. This is not an area to let down your guard.
Absolutely not. Yeah, great to hear that you have all those certifications. Well, as we wrap up, Lauren, I'm curious about how you see the virtual care platforms fitting into the broader healthcare ecosystem. How do they complement traditional healthcare versus competing with it?
Yeah, that's a great question. So we started out talking about the telehealth. It just is. Virtual care just is. It's here to stay. Telehealth will continue to complement in-person care. We all know that there is a time and place for in-person care. There is a time and place that a patient needs to be palpated. But I do believe it's our responsibility to make sure that patients are getting the right care at the right time. And that's not just telehealth, and it's not just in person. It's really an integrated hybrid approach to delivering care. As I said, I've talked about my kids a little bit. I'm trying to schedule multiple appointments for my son. That in a brick and mortar setting, the soonest I can get in is 3 weeks for one service, and the longest is 6 months. And that's just unnecessary. My guess is there is a lot of inappropriate care being served that's unnecessary, and that many of those patients would be better served in a virtual care or telehealth environment. So I think the key to sustainability here in driving appropriate usage, driving down costs, and making sure the patient gets the right care at the right time truly is a digital front door, telehealth as the front door, engaging the patient, pulling the patient in, and allowing board certified clinicians to help direct, clinically guide the patient to the right place so they do receive the right care at the right time. One of my favorite sayings is simplicity on the other side of complexity. And there is no other industry that it should adhere to this more than healthcare. It is a complex web. So I would say in summary, it's critical to keep the person at the center of the care of their own care and consider the consumer experience when considering the future of telehealth.
Lauren, thank you so much for sharing your insights with us today. If our listeners want to learn more about Transcarent or connect with you, what's the best way for them to do that?
The best way to reach out to me is through LinkedIn, Lauren Gums, and to access the care experiences that we offer at Transcarent, it would be transcarent.com. I welcome input.
All right, go and visit those and connect with Lauren on LinkedIn. Lauren, thank you very much for joining us, and thanks to all of our viewers and listeners for tuning in yet again to Healthcare on the Rocks, Employee Benefits with a Twist. Please don't forget to subscribe and leave us a review. It really helps others find the show and helps us know how we can improve and give you what you want to learn more about.
And for more episodes and to stay updated, visit springbuk.com/podcast. Until next time, stay healthy and stay informed.